Good afternoon. I'm Terry Scoggin. I'm the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, August 6, 2021. I apologize today as we do this COVID update because we're going to do it remotely. So please bear with us for technical difficulties and streaming difficulties. And you never know, one of my friends may just call me on the phone during this and put us in a disarray for a few seconds. So please bear with us. But it's critical right now that we decided to get on the phone. I had exposure in the last couple of days to COVID, so I am vaccinated and I am testing negative. But our clinical protocols right now at the hospital, if you're a non-clinical individual with exposure, we're just keeping you away from the hospital if you can work from home for a couple of days. So I've been working hard for my son's bedroom yesterday and today, and we wanted to make sure we did our COVID update. So we wanted to go ahead and do it remotely. So I want to say thank you to the marketing team and the digital team and Bobby more for what he's done to get this up and running today. But we're going to go ahead and get started, and just bear with us that it may be a little slow, but we wanted to get the numbers out to you. We are experiencing our fourth surge, and we've talked about it for the last few weeks. And I've been positive for the last 18 months and 15 months, and wanted to just encourage everybody to social distance, to masking. Today's a little different, and we're starting to see some major changes, not only in Mount Pleasant, Titus County, Northeast Texas, but across the state of Texas and across the South. I'm going to use words like dire today and critical. And there's a lot of people out there who are not going to like me saying that. There's a lot of people who are going to say we're overreacting. Well, I'm going to promise you we're not. And we're going to talk about that today. So let's talk about the numbers. But one thing I have to lead with is a positive. Yesterday at the Family Care Center, over this last week, our Family Care Center team members have been seeing an increased number of patients. Our emergency department has been flooded this week with COVID and non-COVID patients who need to be seen. But our Family Care Center has been seeing many COVID patients outside in their cars, doing testing, checking on them. It's been hot this week. Many of you have been outside, know what Texas in August is about. And our providers out there and nurses out there, our medical assistants, our lab team members, I just want to say thank you and things to ensure. I also want to say thank you to our neighbors. It's been a really tough week and some things. And earlier this week, we got low on our Abbott COVID test, and we had a couple shipments that did not show up on schedule and put us behind. That was critical. And the inability to do immediate rapid COVID test hurts our nurses and our doctors, not allowing them to implement procedures and things right on. So I want to thank some of our neighbors, our friends, a guy at UT Health Pittsburgh, and our friends at Hamilton out in Central Texas and the Hill Country, and Texas Organization of Rural Community Hospitals, Torch. All three of those groups, when I got on the phone Tuesday and asked for help, we had a shortage coming. They stepped up. And I want to thank my son who got in the truck on Tuesday and drove to Hamilton and had 8 hours on the road to get us 8 boxes of test kits that we could use until our shipments got here yesterday. So this COVID pandemic has been critical, but neighbors helping neighbors has been able to get through it. Over the last 2 days, I've spent a lot of time in meetings, both the state and local level in our hospital. I had the opportunity yesterday to meet Dr. Saucier. He is on the White House COVID vaccine task force, and he was in Austin yesterday visiting with the Texas Hospital Association's board of directors. I serve on that board and was invited to attend the meeting. And we talked about the vaccine strategy. We talked about COVID, more importantly, and what is going on at the state of Texas. And I was blown away. We thought it was just us suffering some of the things that we're seeing right now. But the message was clear yesterday that across the state of Texas, that hospitals are seeing a number right now, can only see about 50% capacity that we saw in our last surge early in February and January of this year. Right now, Titus is sitting about 13 patients with COVID and 2 in another, so 15 in total. And our max right now that we can handle is 12. So we've got several who are sitting in the emergency department waiting on rooms, and we're constantly trying to battle that right now at 12. I just got off a phone call with the Texas Hospital Association, where the CEOs and the CMOs from across the state got on together for a quick update a few minutes ago just to see what is happening in the different regions. And we heard it across the board. There is a critical shortage right now of staffing, and there are health systems that are on the verge of shutting down and shutting their doors to the emergency department. We're starting to hear in this area of a couple of emergency departments who have shut down or diverted and move those resources and those staffing to other hospitals. I will tell you now, Titus is still open in the emergency department. The team down there is battling. They are busy, but just like the rest of the emergency departments across the state of the Texas, and so are nurses as well. From our numbers perspective, I said a minute ago we had 13 in the main COVID area and 2 in another area that we're keeping isolated. We believe it is the Delta variant. So you can see that consistently over the last week. Numbers increased from a testing percentage positive, but we've also just seen the amount of emergency departments visits. This is critical, and we're starting to see how contagious this disease really is. It was shared with me this morning a few minutes ago when we were talking. Huge increase from a state level in the 40 and 50 and 50 to 60-year-olds. Greater percentage this time than it was in any of the previous surges. We're also hearing from our children's hospitals for the first time. That was the one that really surprised me. More children on vents today than have been in any time during the COVID outbreak over the last 18 months. RSV has been a huge part of this as well from a pediatric standpoint with COVID and RSV. The one thing that we heard early this morning was an increase in RSV patients in the elderly as well, not just in the pediatric. So you can see as we're in the middle of August and suffering with the RSV crisis and COVID crisis, that this is huge. And children hospitals are turning down patients for the first time in a long time that I've ever heard of, that they are not able to take transfers from the region. So we are concerned, and we're doing things at Titus. You can see from a Northeast Texas perspective, our hospitalized beds have gone up dramatically in the last 10 days. The next slide shows from a Tyler perspective, where you can see just south of us the same thing over the last 10 days. So we're continuing to see that increase. From a positivity and a testing standpoint, we saw last week some of the largest numbers that we've seen on positive from a testing, which you can see we're up in almost 30% from positivity rate last week with 150 positives in this region. Now, I know there's a lot of people saying, well, your hospital's only sitting at 10, 11, 12, and 13, and you have 200. The percentage is about the same. And with the Delta variant, you're or less of hospitalized. But I can promise you, and from the experiences I've seen and heard in other health systems, that those anywhere from that 1 to 2% are still sick. And we don't know how somebody's going to react. And, I had exposure this week. Am I nervous? Yes, I'm nervous. I'm vaccinated, but I still can get COVID. And I've seen what COVID has done, and I've seen the lives that it's taken this week. People are still dying from this disease, and it's serious. To quote some of my friends, the bull's out of the barn. And, it's hard for us to go back to where we were. But one of the concerning things I'm seeing and hearing that is the hospital systems across the state are saying the dam is broken right now, and we're struggling for capacity. We're continuing to see non-masking, and our vaccination rates are increasing, but not at the rate they should. I'm going to encourage all of Northeast Texas. It's time to step up. We need your help. We've asked for things. We've asked for donations in the past. Right now, we need you to help us mitigate this curve. Vaccines is one way you can do it. You can go to online at titusreals.com. You can see our opportunities to get the vaccine. But again, one of the ways we're going to battle this disease and mitigate the spread is by getting the vaccine rate north of 70%. So I would encourage you to get the vaccine. I would also encourage you to mask. At the health system, we're continuing to wear a mask, and we're continuing to change. I hate to announce it, but we are changing our visitation policy this week. With the increase in the Delta variant and the increase of the viral loads and the transferability of this disease, we're having to limit the number of people who can come to the floor. There's people who don't know they're carrying with no symptoms, but they're COVID positive. And that spreads quickly among our staff, our doctors, the patients, and other visitors. So we've had several incidents this week of exposures and unintentional spread from vaccinated and non-vaccinated individuals. So in order to combat that, we are pulling our visitation policy down and limiting it. We're going back to what it was during the COVID surge. We're pulling back some of our volunteer activities as well as the hospital. Again, this is at a time where we believe the health system has to step up and protect our community. And we're going to make sure we do that in everything we have possible. We are requiring masks, and I would encourage you to wear your mask anywhere you go. If you have an N95 right now, I'd encourage you to wear an N95 where you're in public areas. That is just going to protect you at an even better rate than just a regular mask. If you're outside, a regular mask is fine, but if you have an N95, the grocery store or something, I would encourage you to join me in wearing the most uncomfortable N95, but I would encourage you to do it. You know, one of the things on the vaccine, I want to say thank you this week is Pilgrim has stepped up, and during the COVID spread over the last 18 months, Pilgrim has been a great partner, not only of Mount Pleasant and Titus County, but Titus Regional Medical Center. And on the 14th, next Saturday, we are going to host an event. We're going to provide the vaccines. We're going to provide the people to give it. But Pilgrims has stepped up and is going to do an event next Saturday, August 14th at the Civic Center from 8 to 2. Anybody who comes in and gets a dose of vaccine, 21 years and older, will have a chance to win meat for a year. I know that may rub some people the wrong direction, but I just want to say thank you to Pilgrims. They're doing what they can. The Pilgrim plants across the U.S. have a higher vaccination rate than most areas, and that's true in Mount Pleasant and Titus County. So we appreciate Pilgrim stepping up and partnering with the city of Mount Pleasant and Titus Regional Medical Center to offer this vaccination incentive next week to everybody. You know, a lot of stress this week and a lot of things going on, but some positives. I want to show a picture of one of our newest doctors and our physician assistants who were at Region 8 yesterday to talk to our school nurses and do a presentation. On your left there is Dr. Hollingsworth. She's the new primary care physician who started at Titus Regional on Tuesday and is already seeing patients due to the spread of COVID. She's helping out the Family Care Center right now and working with them as we continue to get her clinic ready. And she's jumped right in, and they attended this seminar yesterday to introduce. And next to her is physician assistant Ryan Bilal. Ryan joined us several months ago and be working closely with Dr. Hollingsworth in their community care center that'll open up the first part of September. But we're just excited as all can be to have Dr. Hollingsworth joining our team and what it's going to bring for us. I want to say thank you to all our team members, and really, they're heroes to me. This week has been very stressful at the health system with tests not being at the capacity and then staffing being an issue. We're opening up a separate ICU again. We have had it closed for several months, but we're preparing that as the numbers continue to rise and we are unable to transferring a patient, COVID or non-COVID, is going to be very limited. So we're preparing from a health system for those patients that we can't transfer that in the past may have been transferred. So we're getting ready. And I just want to say thank you to our clinical staff, our nurses, our physicians, our medical staff, our respiratory therapists, our lab, our imaging techs, our EMS, all of our clinical team members involved in fighting this pandemic. I just want to say thank you. You are heroes, and your selflessness this week and stepping up has been amazing. Last thing I'm just going to end on today. First of all, thank you for bearing with us in this not so what we wanted to have as far as a presentation today. The sound may be a little slow. The slides may be a little slow than usual, but we felt it was necessary to get it out to the community to make sure you understand that it is real. And we are dealing with a critical shortage right now of rooms in the hospital, not only in Mount Pleasant, but all of Texas, Arkansas, and Louisiana. As we continue to do this, we ask for your help. Social distance, wear your mask, wash your hands, get vaccinated. We're in this together. We truly appreciate everyone who's supportive of us and helping us mitigate the spread. Thank you for all you do. God bless.